Welcome to An Hour to Give. This week we are featuring the Ottawa Hospital, and we have an incredible story to share. I'd like to welcome Michele Juma to the show today, as well as Dr. Fahad Alkherayf, Director of the Clinical Research Program in the Neurosurgery Division of the Ottawa Hospital. Welcome to you both.
Thank you.
Thank you so much for being here. Michele, tell me a little bit about your life. You're a mom. What else is enriching your life?
So I'm a busy mom of 4 teenage boys. I live in Sault Ste. Marie, Ontario, and I'm just constantly on the go with school and hockey and football and everything else. And I work as well full time, and I'm just active, busy mom and wife.
Wow, a mom to 4. You are definitely my new hero for sure. I know that's a very busy life, especially for boys. So congratulations on that. And I know it's a time in our lives when, of course, COVID has struck. It's a very different time. And Doctor, I don't know about you, but certainly we've been hearing from a lot of different people that some people were a bit nervous to head to the hospital during COVID time. If they weren't having COVID symptoms, they were having other symptoms.
No, that's absolutely right. Yeah.
And it was certainly a challenging time. Are you seeing that in your practice?
Yes, we do. We do see, unfortunately, a patient who is reluctant to come to the hospital or even reluctant to see their family doctors or having some challenging to get that access as well.
Mm-hmm. And Michele, take me to the fall of 2020, basically a year ago. Your life changed, didn't it?
It certainly did. So it was we're just shy of a year from when I sort of abruptly started losing vision in my left eye. I at first thought it was an irritation or some kind, maybe I scratched my eye or something like that. But when it didn't improve, certainly I got quite nervous. So it was started towards the end of September. When it hadn't cleared up by the beginning of October, I was really concerned that something was wrong.
Mm-hmm. And you went to see your family doctor, I understand, Michele.
I did. So I contacted my family doctor and also my optometrist. I initially was in to see my optometrist who didn't see anything wrong with the lens of my eye, but over the course of the next few weeks, I became aware that I had lost color vision in that eye, and the spot that had started small was continuing to grow, and I was losing more and more of my vision in that eye. So I went in to see my doctor, and she sent me for an MRI, and it was in the beginning of November that she let me know that they had discovered a mass at the base of my frontal lobe, right in between where my 2 optic nerves meet. And she said it was putting pressure on one optic nerve and was very close to the other. So that was in the beginning of December. She said she suspected it was a meningioma, and that just given that we don't have the services here, that I would need to be referred out of town to see a neurosurgeon elsewhere.
And then you step into the picture, Doctor.
So I do remember these days really well. It started when one of my colleagues at the Eye Institute, who was, her name is Dr. Alkherayf, was going to see Michele because of her vision problem, but she did call me and said, I'm seeing Michele, or at that time she said, I'm seeing a patient who's coming about 9 hours away from here, and she had already looked at her imaging and had a good idea that this is a tumor which is putting a pressure on Michele's left optic nerve. So she said, I'm seeing the patient who's actively losing her vision, and she's coming far away. Is there a way we could arrange her also to see you at the same time? And totally understanding people coming all the way, it would be totally reasonable to do our best to accommodate that. And that's what happened. We arranged Michele to come and see Dr. Alkherayf first, and then come to me directly from the Eye Institute. While that was arranged as well, I had the chance to look at Michele MRI, And as Michele mentioned, it was very clear on her MRI that there is a benign tumor, which was consistent with what looked like a meningioma based on the MRI. It's sitting exactly underneath her optic nerves and more into the left side, and it clearly was putting a lot of pressure on the optic nerve on the left side, which is basically the vision, and that's explained why Michele was actively losing her vision. And it was clear to me that we do need definitely to do something very quick to save Michele's vision.
Wow. It sounds like a scary diagnosis, Michele. Is that how you felt?
Absolutely. I mean, I know, I felt there must be something significant because you wouldn't normally lose your vision in one eye, but you don't, my mind hadn't gone to the fact that I was within, that that I had a brain tumor that was going to cause me to lose my vision if something wasn't done immediately. And because of the positioning, the potential was there. I had already lost the vision in one eye. The potential was there for me to lose the vision in both eyes if something wasn't done quickly.
So, Michele, how do you tell your husband? How do you tell your boys?
Well, I told my husband first, and he knew I had told him about my vision loss and that I was going to be following up with the doctor, and he knew I went in for the MRI, so we were both as prepared, I guess, as we could be. But all I could do was just say, this is what they found, and this is what's going to happen. And so we were both terrified. It was a very emotional time for both of us over the course of the next few months, and sometimes still is when we look back on everything we went through in that period of time. With the boys, it was a little trickier. We wanted to wait until I knew for sure what was happening. They knew I was having trouble seeing out of one eye, but we wanted to wait, so we actually didn't give them any details until after we had talked to Dr. Albrecht and Dr. Alkherayf and knew what the treatment plan was going to be. But we were pretty careful about what words we used and how we explained it, because as you approach Christmas and as you're talking to your four kids, it's really hard to decide how you're going to explain something like that.
It is definitely difficult. I can't even imagine, to be honest, Michele. Dr. Alkherayf, when you hear Michele sort of talk about those early days, how does that affect you as a doctor?
Well, despite him kind of been doing this for years, I can tell you, unfortunately, this is really devastating news for any of our patients when we tell them that, or even knowing that they're going through this. It is, everybody would be very scared when you tell them that they have a brain tumor, and the first thing would come to their in mind is brain tumor. That's mean I would have going through it, basically losing some of my brain function, and that could be vision, as in Michele's case, or other function, and everybody would be extremely worried. It doesn't matter if we tell them or the report said benign or malignant, because the cancer is one thing, but also losing the function in the brain is also a significant thing. And especially with people who's young and healthy, and they suddenly losing a major function, like losing vision, is a very significant. And it is always a very hard conversation with patients because we do know how they feel about it. It's very hard for someone who's young, losing their vision. The first thing is going to come in their mind, how is the rest of my life going to be? I'm going to be blind. How am I going to function? How I'm going to take care of my family? So it is a very, very hard thing, and it is put a lot of pressure on us in a way that we do know what the patient feels, and it is really we try to deliver the news to the patient as smooth as we can, but we do understand it is not an easy news for anyone to hear, and it does come with a lot of thoughts in their minds.
It definitely does. And Michele, when you look back on that time, what would you have said to yourself if you could have forecasted what the future would look like?
I don't know. I mean, I don't know, looking back, what I would tell myself. I think things happened so, like, it was kind of a whirlwind, and sometimes it felt really, really surreal. But, I mean, we moved quickly. As soon as I noticed something wrong with my vision, my gut said something was wrong. I contacted my doctor. We did some research. We decided that the best place, or the place that we wanted to be, was the Ottawa Hospital, and so, I got my referral there. We went in, like Dr. Alkherayf said, Dr. Albrecht and Dr. Alkherayf were able to see me that same day. I left there with a treatment plan. I understood what was happening. I understood what my diagnosis was, and I just it was an emotional roller coaster, and I don't know what I could have said to myself to help back, what I could say back now, help me get through it. But I had my husband and Dr. Albrecht and Dr. Alkherayf were fantastic, and really helped me feel like I was in good hands.
Well, we certainly want to continue to tell your incredible story. We're going to come back with Michele Juma and, of course, Dr. Fahad Alkherayf, Director of the Clinical Research Program in the Neurosurgery Division of the Ottawa Hospital. Stay with us here for An Hour to Give. Welcome back to An Hour to Give. We're having a really interesting discussion about the Ottawa Hospital and about the incredible work that's done there. Michele Juma, a patient at the Ottawa Hospital, as well as Dr. Fahad Alkherayf, Director of the Clinical Research Program in the Neurosurgery Division of the Ottawa Hospital, are joining me today. So we sort of left off that you were sort of meeting for the first time. And doctor, as you said, when you meet a patient for the first time, you're having very difficult conversations in many cases. Walk us through the next steps that Michele took.
Yeah, so as we kind of mentioned earlier, one of the biggest things was how can we save Michele's vision, and how can we do this really quickly and safely. So after I saw Michele in the clinic, and that time I got a quick report also from Dr. Albrecht about how bad is her vision, I start thinking, okay, how can we do this fast and safely and get Michele also through this with the least trouble. We did needed to do another MRI to prepare her for surgery. I did talk to her that day about the surgery, and we started exploring what would be the best surgery for her. And in a traditional way, we would usually expose Michele to a procedure called a craniotomy, and that would be a very invasive procedure where you need to make a cut in the skin and then cut into the skull, and have to lift the brain up to get access to the optic nerve and the tumor. And those procedures are traditionally done and still done in other hospitals. And however, they do come with a significant risk with that in form of infection, as well as risk of brain injury, risk of not being able to remove the tumor completely or injuring the optic nerve. So we start thinking, okay, is there a better way to help Michele with this? And that's where the Ottawa Hospital comes as one of the centers with expertise in minimally invasive cranial surgery, where we are able to remove the tumor through a totally different approach, different philosophy, where instead of going all the way from outside into the inside of the tumor, can we have a shorter corridor to get into the tumor with the least invasive to the brain? And that's what we do is in these cases where we get into the tumor through the nose, basically. And that's what I had decided that would be the best for Michele's case. However, this procedure does need to have a team assembled. And that's where also, after discuss this with Michele and her husband, we started setting up the team. And what I mean by team, it's really this procedure, even it may look at the end as a surgery, it does comes with a lot of arrangement from hospital as well as the people taking care of it. So such a surgery would require a neuroanesthetist who is expert in the anesthesia and having people going through the surgery with no issues. The other thing, it also requires an ear and nose specialist who we do. I'm very proud that we have the expertise here at the Ottawa Hospital. Dr. Sean Kilty was my partner on this surgery, who comes with a significant expertise in skull-based surgery. It is because this surgery does require two surgeons to be working together. And also, one of the things we do in this procedure, we monitor the function of the brain, and in particular in Michele's case was her vision, and that would require a neurophysiology team where they sit and help us with this during the surgery. So understanding this is a lot of work and team need to be assembled. That was my second step, is trying to get these arranged in a short time, because I do also in back of my mind is if we don't act very quickly, Michele will lose her vision in the left eyes, with possible also affecting the vision in the other eye.
Wow. Michele, what an incredible team to help you. There was so much information in what Doctor just shared. It really is sort of hard to follow as maybe somebody that isn't a healthcare professional. Was it hard to understand the process for you?
You know what, Dr. Alkherayf, you were fantastic in explaining the process, the procedure to myself and to my husband. We were also able to see Dr. Kilty before we left town that visit, and he explained his role. But fortunately, my husband was able to be there with me to answer the questions that I was forgetting to ask, or to ask the questions I was forgetting to ask, and to hear what was being said in case I was missing any of it. I mean, that was critical for me to have him there and him able to hear some of this as well, so that I didn't miss anything. But it was a lot. But certainly, both options were explained: the craniotomy and the minimally invasive surgery, and certainly the minimally invasive approach was sounded like a much better option.
Mm-hmm. This is just another example, as I'm hearing Michele speak, Doctor, where it really becomes evident that, of course, you're working for the patient, but it really needs to involve the family in many cases.
Yeah, you're absolutely right. And it's always, especially with the modern medicine, there is more than one way usually to do any kind of treatment. And as a doctor, we try to do our best to explain the things to the patient. But I want to mention something also Michele has touched on it. One of the challenge in neurosurgery, and in case like Michele, it's a lot of information the patient would be receiving. In top of that, they are just dealing with what they have been told about their diagnosis. So it is a lot of to digest in a meeting, and it is very hard for anyone to kind of understand all of the information provided when it's come to you telling them that they have a brain tumor, they're losing their vision, and if tumor is not removed, the vision would be lost completely. And at the same time, you start explaining to them the surgery and the options. So I totally understand that with patients there, what's going to be in their mind. They will be hearing us talking about the surgery, but also at the same time, they're still thinking about what we just said about the tumor, what it means to them. So it is a very, very hard conversation for people, for patients to kind of completely get. So we try our best to make it is easy on them, and it's always, as in Michelle's case, having another person or family member, it always be helpful, because it will help to get them to make a decision. And in Michelle's case, for example, where we were discussing options, that would be really helpful, because having someone to help asking a question where the person may not think of it at that time, because they're maybe more thinking of something else, it does put a lot of insight on the options of the treatment, and also help the physician to move on with the treatment.
Absolutely. And Michele, you leave the Ottawa Hospital and you leave Dr. Alkherayf, and you know you're heading home to Sault Ste. Marie to the 4 boys. What are your thoughts, Michele?
My mind was racing, and my husband's mind was racing. How were we going to we were leaving Ottawa on a Friday, and I was due to be back on Monday night. So I really only had a weekend. And I just, I had to think about the diagnosis, the treatment, what was going to happen over the next week. Fortunately, my sister-in-law, immediately as soon as she heard, she said she was working from home due to COVID. She said, I'm on my way. I can work from anywhere. And so she drove to Sault Ste. Marie and stayed with the kids while we were gone. It was pulling all of these things together and trying to stay, strong, reassuring my kids when they were asking questions, that in my heart, I felt like I was in the best possible hands. I felt safe with the doctors who were going to be working on me. Those were important messages that I gave to them. We're approaching Christmas. I knew I wasn't going to be able to do any more Christmas planning than I had already done. So wanting that to still be a special time for my kids, trying to put all those plans into place, all of that was going through my mind. And it was a 9-hour drive back to the Soo. It was overwhelming for both myself and my husband. Telling my other family members, my parents and my siblings, and it was an exhausting ride home.
I can't even imagine, Michele. Thank you for sharing your story with us today. So, Dr. Michele is on her drive back to the Soo, and we know that you're very busy. All doctors are very busy. But do you ever sort of, after maybe the time with Michele, sort of take in the conversations that you had with her? Like what's it like to be a doctor, share that news, know that you're going to be operating on this mom of 4? Is there an emotional moment for you?
Oh, absolutely. I'm also father of 4 kids, and I do know what kind of it's really mean, kind of being away from your kids and going through kind of a major surgery. I cannot put myself in Michelle's shoes, and I totally understand how it is really scary for her and for her family, and that's where it's also scary for me as a physician. Is I trying to do the best for the patient, but I also, in back of my mind, this is a mother of 4 who's taking care of 4 kids, so it is very emotional to me and to any other physician who's treating patients, because we know that her kids are waiting for her, and it's a holiday season. Everyone want to be with their loved one at this time, and how can we do this really safely and get her back to her loved one?
Absolutely. We have so much more to talk about in this story. And of course, I don't know about you, but I am tearing up. I mean, this is an incredible story. And we're really appreciative to both of you that you would share this with us on An Hour to Give. We're going to come back with Michele Juma and Dr. Alkherayf from the Ottawa Hospital on An Hour to Give. I'm sure you're all wondering what happens next. Michele Juma is joining us, a patient at the Ottawa Hospital, and Dr. Fahad Alkherayf from the neuroscience department. Michele, you were talking about this incredible journey that you've taken. You've obviously headed back to Sault Ste. Marie. You've spent time with family. You only had a few days. You're heading back to Ottawa on that Monday night. Walk me through that night.
So we headed back. My surgery wasn't until the Thursday, but we needed to head back so that I could have another MRI done and other preparations for surgery. Fortunately, we were able to stay at the residence, which was wonderful. It was a godsend because my husband was able to stay there, and it's right across the parking lot from the hospital. So he was readily available, and that's where he stayed for the week that I was in the hospital. So we made our way back. We had dinner together the night before, and then the next morning I was up early and had to be at the hospital for 6 a.m. Mm-hmm. Because of COVID, there was limits to how far he could go with me. Mm-hmm. But again, every member of the team was fantastic. The nurses who checked me in and Dr. Alkherayf and the whole team, everybody was reassuring and kind and compassionate. And there was a lot of people there with a good sense of humor that were able to make me smile while we waited. So, so again, I as I was there waiting to be brought down the hall to the OR, I knew I was in the best of hands, that I was where I needed to be. And then prior to entering the OR, I remember Dr. Alkherayf and the whole team and introduced themselves to me again. And, of course, I knew who you were, Dr. Alkherayf, but everybody introduced themselves to me again and let me know what their role was. And that was reassuring, too, because at this point, everybody's in scrubs and they have masks on, and you don't always recognize who everybody is. But that was important to me, actually.
Michele, you mentioned you and your husband had dinner together the night before. What did you have for dinner? What was that dinner like?
We ordered in actually a big Chinese meal. My husband loves Chinese food, and I thought if I ordered Chinese food, there'd be leftovers for him to eat during the week.
You know why I love
so that's
that?
What we did.
You know why I love that answer so much, Michele? Because that just shows you are a wife and a mother. You are thinking about what he's going to be eating while you're going in for surgery. I just fell in love with you even more. Doctor, I love the fact that Michele talked about, meeting the team and working in a team like you do. What's that like? You're all really depending on each other.
Yes. Absolutely. You just said it. We depend on each other. So any kind of success of any part of Michele care would depend on all of us. And the same thing goes with all of the other patients we treat, especially when it's come to skull-based surgery in a case like Michele, where it's a complex case, many people get involved. It is really making me very proud of what we do here, where really your success depends on the help with the others, working as a team. Like, you can't be a successful surgeon without having all the support and the effort from your colleague, like the neuroanesthesia, the ear and nose specialist, the neuro-ophthalmologist, the neurophysiologist helping you during the surgery. It's amazing. It's like basically a sport. It's not one-man show. Everyone has to do their best to provide the care of the patient, and your success cannot only depend on you. You will need help from others.
I have to ask you, Doctor, about the sense of humor that Michele alluded to that was happening as the team was being introduced. How important is a little levity in such a serious situation?
It is. We do our best to make really people feel as comfortable as they can, because that's part of also their care. You can't get the patient to go through surgery without trying to release their stress and having sense of humor, which is I'm proud that most of the people at the Ottawa Hospital has strong belief with that, in a way that how can we really relieve the stress on a person who's coming knowing that they have a brain surgery, they are losing their vision, for example, in Michele's case, and they're going through a major part of their life. And yes, we do this on day-to-day as a surgeons, as nurses, as anesthetists, but we do know what that means to the patient. We do know how stressed they are, and everything we can do to relieve that stress. I think everyone is doing their effort, and I'm proud of the team we work with. They do share the same feeling as I am, and they do understand what it's mean for the patient.
I love it because I know how talented and professional you are, but of course you're also human, and I think that's excellent. Thanks for sharing that, Doctor. Michele, what do you remember next?
The next thing actually I remember is Dr. Alkherayf waking me up and to say that the surgery was done and that it was a success. I wasn't awake very long, but long enough I can still remember seeing him, and as he let me know that everything was okay. I slept a lot over the next few days, most of the time. So most of what I remember, was in little bits and pieces. I know my nurses were fantastic. I had a lot of visitors from Dr. Alkherayf, from his team, from Dr. Kilty, from an endocrine team. But my questions were always answered. When my husband was able to be there, his questions were answered. And I was very well taken care of. One of my most memorable moments was when I woke up, and this may have been the day after my surgery, and my husband was there, and I was aware that I could see him clearly out of both eyes. And I told him so, and we were just in awe, like we couldn't believe that, because there was never any guarantees that my vision would be restored. There was certainly hope, but we couldn't guarantee anything. And for my vision to be restored fully and that quickly, we were just stunned.
Wow. Amazing. Dr. Alkherayf, how long does a surgery like this take?
It does take quite a time, actually, because there is a bit of a preparation at the beginning of the surgery and at the end of the surgery, in addition to the surgery itself. So roughly it would usually take about 8 hours, and sometimes it could be longer than that.
That's incredible. I mean, I just can't even imagine that. And you get to share the good news with Michele. You got to say it was a successful surgery. What does that do for you when you're sharing that news?
It actually means a lot to me, and I'm sure all surgeons would feel the same. We're here to help Michele and other patients, and really knowing that the goal is achieved, it does mean a lot. It's mean basically all the effort, everything we have done was successful, and we are able to get her back to her life. I know it's early at the time of her surgery, but knowing that we were able to remove the tumor with restoring her vision, it meant a lot. It meant that we're having a mom who's able to go back and take care of her kids, a young person who's able to carry on with the rest of their life without needing to worry about their vision. There's someone who's able to go back and enjoy their life, enjoy their hobby, go back to work. It does mean a lot.
When you think about the Ottawa Hospital now, Michele, and the time you spent there, what do you think about? Do you think about the people?
Absolutely, because I couldn't thank them enough, and the care and compassion, the empathy, it was. I mean, I'm eternally grateful. I mean, it was just if you're gonna be going through all of that, there's no other place that I would rather have been. So, absolutely.
I mean, I have to say, Dr. Alkherayf, you could probably work anywhere in the world. Why the Ottawa Hospital?
That's a really good point and a good question. So, something to share. I moved to Ottawa a while ago, about close to 20 years ago, and at that time we didn't have kids. So I moved with my wife to Ottawa, and Ottawa has always, since that time, became basically our home. All my kids are born here, and two of them actually born at the Ottawa Hospital, and it does mean a lot to us. As the city, at the hospital itself, I did my initial training at the Ottawa Hospital. So I do really feel part of the Ottawa Hospital. It's my home when it's come to work. It does mean a lot for us as a family. And on top of that, it does really, it's an excellent place to work when it's come to only looking at work. It has a lot of support for any physician. And speaking myself, I had a significant support from everyone at the hospital at the level of the managers and support. They help you to really achieve your goal by taking care of patients, and also they help you to expand your horizon, bring what would be best for your patient. They would be very supportive of you bringing new ideas, new techniques to the hospital to taking care of your patient. And it is, in my view, one of the best centers in North America to work in.
Well, we definitely agree on that. I'm a big fan of the Ottawa Hospital, of course. We're going to come back. We have one more opportunity to talk about this incredible story with Michele Juma and Dr. Fahad Alkherayf from the Ottawa Hospital. Stay with us here on An Hour to Give. Dr. Fahad Alkherayf and Michele Juma are joining me to talk about this incredible story from the Ottawa Hospital. Dr. Alkherayf, I'm absolutely fascinated with the technique that you used. Walk us through a few more details.
Sure. So one of the challenges when Michele's surgery was, we know that the tumor is really glued basically to her optic nerve, and the main goal of the surgery is to remove the tumor without causing any damage to her optic nerve, so her vision could be restored. So I did mention about the going through a minimal invasive where we use the nose as an approach. But in addition to that, we use a few things to help us to really have very good accuracy and precise ability to see the tumor, to see the optic nerve. And one of the things we do have here at the Ottawa Hospital is a really high-end telescopes, which give us a really high magnification of what we see during the surgery, and being able to remove the tumor precisely from her optic nerve without causing any injuries. But one thing also I'm very proud to have at the Ottawa Hospital, and I'm proud to say we are one of the unique centers in North America who has adopted this technique and developed it, is the visual evoke potential. I know the name sounds very technical, but basically what it allows us is to have a direct monitoring of the Michele vision during her surgery while she's asleep. So what does that mean to me is being able to receive a feedback of how is Michele vision during her surgery while I am removing the tumor. If we do anything kind of would harm her vision more, I would know immediately during the surgery. And that's not ever been done before in a way that the surgeon would know what's happening. A lot of time we know the result after the person wake up or the patient wake up from their surgery. But having that the ability to really know what's happening to the patient vision or Michele vision in this case, it's allowed me to minimize any risk of injuring their optic nerve and achieving the goal of restoring her vision.
There's one thing I know about specialized equipment. I know it means that donors were behind that, that donors would have supported that equipment. Am I right about that, Doctor?
Yes, you're absolutely right. I mean, I think between doing the standard of care or going beyond that, it does really mean a big difference when it's come to the support. And that's where, in my view, donors and would help the community, like in achieving that. The Ottawa Hospital does depend on the help from the donor, and without that support, we would not be able to achieve such really high level of care.
It is incredible, and we are so grateful to all of the donors at the Ottawa Hospital for sure. Michele, your surgery happened December 17th of 2020. You received good news from Dr. Alkherayf that the surgery was successful. What happens next? You obviously recover. You said you slept for a few days. I'm sure as any mom, you're looking forward to getting home for the holidays.
Absolutely. And that was on my mind the whole time that I was in the hospital, that I wanted to get home and be with the kids for Christmas. But of course, it was making sure that I was well enough to go. And my husband kept saying, it's okay. Like, if let's don't push things. But I was discharged from the hospital the morning of December 27th. And we started the long trek home. I got home at 11:30 at night, Christmas Eve, and was able to spend Christmas Eve and Christmas Day with my kids. And that was a miracle for us.
So you see your boys in full color. What's that like?
It was wonderful. There's nothing better than that. Nothing. I have seen since the surgery, my kids are back on the ice playing hockey. They're playing football. My twins got their driver's licenses. All of these things, we I even did a ropes course and a zip line course at the top of Grouse Mountain. And to see, all of this and experience with my kids it's wonderful. It was our Christmas miracle that I was home. I was able to be with them, and every minute since we've just cherished. My husband said it was right out of a Hallmark movie.
And Dr. Alkherayf, you know that she's heading home to those boys, and she's going to have holiday with them. What's that like for you?
It was my Christmas gift from my patients. Really, knowing someone is going home to enjoy their time with their loved one, it meant a lot to me.
It's fantastic hearing this incredible story. It's very emotional, Michele. Do you still get emotional thinking about it?
Absolutely. My husband and I both do, quite often.
Is it hard to talk about, Michele?
Sometimes it is. When I look back and I think about everything that we went through and everything that I'm so grateful for now, it definitely brings tears to my eyes.
And to mine. I have to say, this whole story, and I'm sure our listeners are feeling the same way today, it's a very emotional story. And when we, pass the campus of the General, or we pass the campus of the Civic, and we know that many of us have walked in the doors of the Ottawa Hospital like you did, I think these emotional stories really center the fact that in many ways the hospital is the heart of our community. And Doctor, did you think about Michele through the holidays?
Yes, definitely. I mean, it is that night, the Christmas Eve, I was with my family, and one of the things really came in my mind is Michele and how she's spending the time with her family. As I said, Michele also had a special something to share. We have 4 kids, both of us, so that's kind of was one of the things which I was thinking of it at that night.
For sure. Michele, have you found the words yet to thank the team and Dr. Alkherayf?
You know what? Words honestly can't describe how grateful I am. Dr. Alkherayf, to you and your team, my family and I just can't thank you enough for all that you've done for me and for us. Honestly, you're an exceptional surgeon. You're a wonderful doctor and caregiver. You helped me to feel reassured and safe. You gave me my vision back and you gave me my life back. And to us, you're our hero.
Thank you.
And how does that make you feel, Doctor?
It makes me very emotional, to be honest. It does mean a lot to me. And that's mean a lot from receiving these nice words from my patients, really.
I have to ask you, do you remember the day you decided you would become a doctor?
Yes. I don't think if I remember the exact day, but I remember kind of the age at that time. I was in grade 8.
And what was the factor? Why did you think that this might be your career path?
I'm not quite sure, but one of parts of me was trying to make a difference, and I felt maybe at that time that being a doctor would be something I can really make a difference in with helping people, and I believe that's where I decided.
Mm-hmm. It's amazing. As I'm sitting here, listening to this story, I know that so much of the success of the surgery was because of donors at the Ottawa Hospital. Only that specialized equipment, like we said earlier, gets purchased because the community believes in it and believes in the talent at the Ottawa Hospital. What would you say to donors, Michele, if there's listeners right now that contributed to that specialized equipment? What would you say to them?
I would say thank you, and to anybody who is considering donating, please donate. I mean, I wouldn't. My life would be very different right now if I didn't have the care that I received there and the special equipment, and it was remarkable. It was about I believe it was about a golf ball sized tumor that was in my brain that they removed without damaging my optic nerves, the blood vessels around it, or my pituitary gland, and here I am, healthy, active again, and doing everything that I did pre-surgery, and I wouldn't be here if that was not the case, if not for the donors. So thank you to those that donated, and anybody who's considering, please do.
It has certainly been my pleasure to share this time with you and hear your story, both sides of the story, which has been really, really interesting today. Dr. Alkherayf, what would you say to Michele as we end our time together today? Well,
I would like to thank really her for allowing me to be part of her care. I think that's mean a lot for me and for the trust she had on me and the team as well at the Ottawa Hospital. And definitely wish her the best with her family, and hopefully she does not go through a similar experience for the rest of her life.
Absolutely. Michele Juma, thank you so much for so bravely sharing your story today, and I wish you all the best. And although it's it's early in the fall, I'm thinking about Christmas and this upcoming Christmas for you, and I wish you all the best. And Dr. Fahad Alkherayf, I don't even know where to start. I mean, you're an incredible surgeon, an incredible person. Thank you for spending time with us today on An Hour to Give.
Thank you.
Thank you so much for listening to An Hour to Give. If you've been inspired like I have been inspired, you'll definitely want to reach out to the Ottawa Hospital Foundation and make a donation. Thanks so much, everyone. Have a fantastic weekend.